On my phone now, it says leave meeting or got it. What do I press?
I just
Or do I just leave it?
Yeah. Good evening, everyone, and welcome to this patient focus program that's being run by the British Society of Interventional Radiologists. I'm really thrilled to have three other gentlemen with me to talk about this very new and exciting procedure called mechanical thrombectomy. Just to go around and introduce everyone, I have a colleague of mine, Aubrey Smith. Hi, Aubrey.
Hi, Raghu.
And we have very grateful to two of our patients. I have Mr. David Parkinson. Hi, David.
Hi.
And I have Mr. Andrew Moore. Hi, Andrew.
Hello.
Good. Thanks everyone for joining us. And as I said, this is a patient-focused panel. So essentially, we are here to listen to our patients and see how their experience has been. Hopefully, it's been good.
Yeah.
And the topic for the evening is mechanical thrombectomy. Now, we all know that stroke is the fourth largest cause of death in the United Kingdom and the second largest cause of death globally. And about 100,000 people in the United Kingdom end up having a stroke every year. That's almost 1 every 5 minutes.
Didn't know it was that bad.
Yeah, it is that bad, David.
Right.
And the cost to the NHS because of this is roughly estimated at 9 billion per year. So it is a procedure that has come about fairly newish, causing a fantastic change in the treatment paradigm for stroke. So what I'm going to do is I'm going to hand over to Aubrey to ask him the question, can you tell us what mechanical thrombectomy is? And can you also tell us briefly as to how it is developed and in what kind of patients it might be used, Aubrey?
Yes, thank you, Raghu. So I think first thing we need to say is, so what is a stroke and what is mechanical thrombectomy treating? So a stroke comes about by one of two ways, and it's either because a blood vessel that supplies the brain becomes blocked, or there has been a bleed on the brain, and this results in brain damage. And this can result in either long-term death, long-term disability, or it can result in death. Now, in terms of looking at the numbers, that's about 85% of these tend to be as a result of the clot blocking the blood supply to the brain. And out of all these patients that are presenting with stroke, about 10%, so 1 in 10 of these patients would benefit from having a mechanical thrombectomy. And the process of a mechanical thrombectomy is trying to take that blood clot out from the brain so it can allow the blood flow to get back into the brain and stop there being any further damage to the brain tissue. Now, the way that we go about and we do that is we take the patient into our room, into the operating room. We get access to the top of their leg in most cases, but it can be via the wrist as well. And from there, we take some tubes called catheters up to the level of the neck, and then take some further catheters, smaller ones, up to the level of where the blood clot is. And we can either do different ways of trying to take it out, either by suction, where we try and suck the clot out, or we use sometimes a stent with suction to try and get the clot out. And once we've got that clot out, we can then see that the brain has got re-established normal blood supply and hopefully stop any further stroke.
So restoration of blood supply then, Aubrey, as quickly as possible is key for it, isn't it? What kind of symptoms? What I'd like to do is to ask David to give us a brief about what happened to you and what symptoms did you have and what brought you to hospital, David?
Day before at work, when I was doing was building a lift shaft, and there was a lot of climbing involved, up the ladder with the stuff. It's on it where we could get into it. We couldn't get up with forklift, so we kept climbing up. And I kept getting pins and needles in me right hand that day. And when I come home, I said to my wife, "Oh, I don't feel too good," but I said, I didn't think it would look like that. I just said I don't feel that good. And so we just had tea, and I just went to get a shower, and I went in shower, and I thought I genuinely thought I'd slipped in shower. I thought I'd slipped over, and then I was shouting with my wife, and she come in, and she knew straight away. She went, "There's something wrong with you." She said, "All your face is dropped and that lot." And I couldn't. When I realised there was something wrong, that I couldn't push myself up and get myself up out the shower. So that's when she realised. She asked me to try and lift my arm up, and I couldn't lift my arm up. And so she started telling me I'd had a stroke. But I just thought I'd slipped over in the shower. I didn't think I'd, collapsed.
And what did you do? Did you call an ambulance immediately?
Yeah, it was called an ambulance, but the ambulance, to be fair, took 2 hours to come.
Right.
So I know we know everything's busy, but look at it. But I'm like saying, my wife's a lot smaller than me, so there's only her in, and we have got 2 sons. Lucky enough, one of my sons doesn't live far away, and he's a big lad, so he picked me up and got me out of the shower. So I remember being laid in the shower, so I waited. So we after about 6:15 when I had the stroke. And what time did it come about?
The ambulance came about, I'd say about 8:10.
About 8:10 when ambulance got here.
Right. And then you came straight into hospital.
Yeah, come straight into hospital. Yeah.
Right.
And
what about you, Andrew? How did you present and what happened?
To be honest with you, I didn't think I had any previous signs. But when I got asked it by some of your colleagues in Hull, if I had any signs prior, and I said no. But it wasn't until I got home, I remember 1 or 2 things that did happen. I think it was maybe 2 or 3 weeks prior to it. I got up with cramp in my ankle, so I got up to the bathroom, and then I saw my legs sort of gave way, and I sort of fell over the toilet and banged my sort of lip on the cistern. But I thought that was my cramp. My wife shouted, "Are you okay?" I said, "Yeah, my cramp. I've just give way because it was got a cramp in my ankle." That was one thing. And also, maybe a few weeks before that, I got some double vision. I was talking to a forklift driver. I got double vision, but it sort of went in about 5-10 seconds. Then that was it. Up until the morning, it was a Thursday morning. I can remember the date, so it was my dad's birthday, and I felt great that day. So we just got going. We got up on scaffold, just about to get started. In fact, I had started. And then I started feeling strange. I went down to pick some mortar up with my trowel, but my hand wouldn't allow me to pick the mortar up. So, yeah, I climbed back off the scaffold, said to my mate, I says, "Look, I don't feel very good, Wayne." He says, "Look, sit down, have a minute." So I had a minute. And then that was it. My speech totally went. I got paralysis in my right hand side, and that's basically how it started for me.
And remind me, Andrew, you were not in Hull at that point, weren't you?
No, I was in York.
You were in York. Okay.
Yeah, I was working in Fulford in York.
Right.
It took around 10 minutes for an ambulance to come for me, which was really good. Yeah. But I don't know if that's because I were in York, or because they were only local to me. I've no idea, but the ambulance came in 10 minutes. And I remember some guys on site helping to get me onto the ambulance, because there were 2 girls who came with the ambulance, the 2 paramedics. I think they were going to struggle a little bit. So the guys helped me over to the ambulance. And that's sort of how it happened. Just
Okay.
felt like it was all of a sudden, but I guess there were signs before, but at the time, I forgot about it, and it weren't until I got home afterwards. So I
you
remember,
realise, yeah.
yeah.
Okay. Aubrey, can you give us an idea for the sake of patients? Obviously, there's a patient-focused panel about what are the signs that people would be looking out for and saying, look, I'm having a stroke. If you look at David had some pins and needles and stuff, isn't it? And then slowly went on and finally fell down in the bathroom. So what would somebody look at, and how would they?
Well, Raghu, I think thank you very much to David and Andrew. I think they've highlighted some very important symptoms that patients should be aware of. And I know that there has been campaign by various people like the Stroke Association saying about FAST. So when we say about FAST, we're looking at signs such as facial weakness, not being able to speak properly, arm weakness, leg weakness, essentially where one side of the body is not responding the way that you would expect it to do. And also then your speech. So if your speech is disturbed and it's slurring, that is another important sign. And when we say with the T, it's time to call 999. In the end, when we're trying to deal with stroke, it is a time critical illness, really. We need to identify it early. And part of that is the patients, people in the community being able to recognise that these are symptoms of this, and from there we can then provide the treatment in a quick and timely manner. And as I think amongst us clinicians, one of the things we do say is time is brain. So the quicker we can deliver the procedure, the more brain we're going to save.
Yeah. Well, that's what my wife realised. No, off the advert, off the telly, that's what she was making me do, making me lift my arm up and try and making me talk, because she seen the advert on the telly, so that's what that was. So that helped us.
I think what we're all saying is that, you need to look at it like a brain attack, like a heart attack. It's something that's time critical. You want to get into a hospital as quickly as you can.
Yeah.
Need to get that treatment. So what happened, David? Tell us about what happened once you reached the hospital. Do you remember what happened? What was the process like?
Yeah, well, yeah. So I remember when I come in, you know what I mean? They said you said there'd be a couple of hours for it to thing. And then you went down and you took me, well, I think so. I'm trying to think. Well, my wife will tell me. My wife, she knows a bit better than me. So what happened?
The team stroke at the hospital was fantastic. There was all the team was all waiting for David to come in. They took him down straight away for a scan on his brain, and then they took him straight up to the ward. And I think, is it a 4-hour window you have to get the medication?
We will talk about that. So it got the scan immediately, isn't it?
Yeah. They had the scan immediately, and they got him on the ward straight away, and then got him the medication that he needed. Yeah.
And David, we can't see Mrs. Parkinson well.
Sorry.
Yes.
Hi.
Most welcome to
I remember it like it was yesterday. Yeah, it was very scary, very scary.
I can imagine that, and how many days did you stay in hospital, David?
You was 8 days.
8 days I was in. Yeah.
Right. Okay. Right. And how about you, Andrew? Do you remember coming into hospital? What happened? Can you tell us about that?
Okay.
I remember being took into York. And, I can remember going through the scanner, but that's about as much as I remember about York. I remember going in the ambulance to Hull. I don't really remember much about Hull, to be honest with you. I can only remember what my wife has been telling me.
So obviously you don't remember me performing the procedure on you. So
I can't, sorry. I do apologise.
Yeah.
But yeah, I remember going to Hull. I think I had they call it the magic drug. I'm not sure what they actually call it, to be honest with you, in York. Then they took me over to Hull. And that's about as much as I remember, to be fair. So I could start talking again.
Yeah.
so tell us a bit about how many days did you stay in Hull?
I stopped in 5 nights.
5 nights, okay.
Yeah.
Okay. And by the end of 5 nights, you were talking and ready to walk out?
I was having a shower day after, to be honest with you. I felt as if I were back to normal, but do you know when you walk about and you start feeling a little bit tired? That's how I felt soon after. But yeah, I was having a shower day after.
We'll come to the recovery aspect of it. Now, I'll go to Aubrey to ask him a couple of questions and clarify a couple of things for us. One is, David and his wife were talking about the magic drug that the IV.
I can remember you pushing the pipe, and I felt it. I remember feeling it getting sucked out of my head. I felt it suck out my head.
It is painful, isn't it? So,
Yeah,
Aubrey, can you?
Felt hot.
It does, yeah. It gives you a warm feeling. So, could you tell us? And there's a question coming up. Somebody has put a question on the box saying, "Why are some people suitable and others not?" So, you kind of tell us what is the suitability part of it from the point of view of time for coming into hospital, the kind of patient you would select, and what exactly is done. Thank you.
Thank you, Raghu. I think if we start off with the medication, so what that is a blood that is a medication that helps essentially try and destroy the blood clot that's there, that's causing the blockage. And the way that we practice and the way that we decide which patients are going to benefit most is by research and trials that have been done over a period of time. So in terms of this medication, initial trials which showed that it was effective was back in 1995. And back in then 2008, there were further trials which said that actually, as David's wife said, it extended, so you could actually include patients who had presented with 4.5 hours and who hadn't had a bleed on their head. So those are the patients that you'd want to try and include as much as possible with trying to give this medication, and who had no further other contraindications, such as if they had some recent surgery or anything like that. So those are all things that would be taken into account when giving that medication. When it comes to selecting patients for mechanical thrombectomy, I would say the golden era for research for mechanical thrombectomy started in 2015, when there were 5 studies that were done, and they showed that this was such an effective treatment that you only needed to treat 2 to 3 patients to be able to get a good outcome for them. So it's a really, really effective treatment. And when we were looking at that, when those studies were being performed, they were looking at providing this treatment effectively within a 6-hour period. So that's from the time that the patient had the onset of their symptoms to the 6 hours. And the reason at that stage no other people were included after that, because there was a risk that these patients might not do as well if the clot was removed after that time. And the reason for that mainly is risk of hemorrhage, because we're allowing more blood into tissue that has unfortunately died at that stage. However, there is ongoing studies and research going on all the time, and what we're trying to do is try and include more and more patients in this who can receive this procedure, and people are working tirelessly at that. And now we have procedures in place, such as we have the National Optimum Stroke Imaging Pathway. That's a pathway that allows us to get the most out of the NHS resources and allows us to identify more patients. And we have advanced imaging, which allows us to select patients beyond that 6 hours. And more centres within the UK are getting that. And now we're able to provide that to more and more patients.
So essentially to sum up what you're saying, Aubrey, is that it is time sensitive. If you think you're having a stroke, come into hospital quickly because you could have this procedure, but it's not necessarily that it's just 6 hours. There are patients who will benefit even beyond that window. So do come in and try and see whether you're suitable for it.
Absolutely. If you get symptoms like this, it's the quicker you get to the hospital, the better, because then we can investigate it and provide the best treatment as quickly as possible. And as I said to you, as we said, Raghu, in the end, time is brain, and the quicker, everybody's different. Just to give you an idea, if somebody's stroke is advancing quickly, their brain can age up to 10 months a minute. Whereas if you had somebody whose brain wasn't as badly affected, their brain may age only 9.9 hours, about 9 hours a minute. So the quicker we get, we can't tell which patient's going to behave like that. Who's going to go rapidly downhill or not. So the quicker you get into the hospital, the quicker we're able to provide that treatment.
Yeah.
That's perfect. Tell us a bit about your recovery, David. You told us about your symptoms and stuff when you started off. So how has your recovery been? And can I ask when you had this procedure done?
Yeah. When I had it, like say, when you had me,
Which month? How many months before?
Oh, I've only had mine. I've only had it 4 weeks ago. Mine.
It was October the 12th.
October when I had mine.
So yes, so we can already see that you're so much better. But tell us a bit about recovery, how you're feeling, and how you're trying to get back.
Oh well, there's a stroke team come. There's a nurse and a physiotherapist come, and so they come and give me some things to practice and that. And my wife is always on at me for making me do stuff, making me do me exercise and that. So, I'm like the other lad who's on it. I've been a bricklayer all my life, so what I find is hard is not, filling my day up. So I do what I can, you know what I mean. But I'm not really, I'm not really allowed. Well, I'm like a puppy. My wife don't let me out. We out there. Because I have been out once and fell over. So I go out with my wife. I go out with my wife and get a bit of fresh air and that. So,
but it is a remarkable recovery, isn't it? Just 4
yeah,
weeks.
because I couldn't walk when it first happened. I couldn't walk at all or talk. So. But yes, well, we're having that. You know what I mean? I think it has made me recover a lot better, having the procedure what you did.
Wonderful. Andrew, tell us a bit about your recovery. How did it go about?
Yeah, I had my stroke back in 2021, 5th of August to be precise. Luckily for me, I was back at work within 7 weeks from that date. It was tough, but I started back on 3 days a week, then I went to 4 days a week, then back to full time. But the recovery, I'm a very determined person. So within a couple of days of coming out of hospital, I was begging my wife to go out for a walk, believe it or not. Anyway, after about 4 or 5 days, she let me walk around the block. I tended to walk a little bit further than that. but my mum and dad caught me and brought me back. But as for recovery, I think I've recovered excellent. I feel back to how I work in comparison how I was. Yeah, I think I recovered really well, to be fair.
So
Good.
something to look forward to, David, and you'll probably be
Absolutely.
back to square one as you were before.
Yeah.
Yeah.
Well, that's
And-
good, isn't it? But then when you said I had an heart attack as well, didn't you? When I went down for the scan, that I've had an heart attack on top of mine, hadn't I? So that worries me a bit still.
No, but I think you're on the right road to recover.
Yeah. Oh no, I'm feeling good. You know what I mean? I'm like him. I'm positive. I need to get back to work. You know what I mean? I miss being with lads and that and being all and you know. I'm not one for sat watching telly. If I don't become a bricklayer, I'm going to become an antique dealer watching off the antique things.
Yeah. Any thoughts on recovery, Aubrey?
Yeah, I mean it's an ongoing process. I think from the minute that you leave the theatre, and it's provided by it's multifactorial, really. It involves the stroke team, the allied professionals. So you'll have speech and language, you'll have physio, you have all the nursing, and you have the district nurses. You've got so many people who are involved in the recovery process, as well as obviously, and it's all centered on the patient, as well as the family who are around you to help support you and to get through. It's as you can see, it's fantastic. It's wonderful to see that you've all done so well after your procedures, and that you've gone on really from strength to strength. From the medical side of things, there's always ongoing research to try and improve, and these resources are becoming more and more available. So yes, I mean the recovery process is multifactorial and involves a lot of people, but obviously it's very fruitful by the end of it.
Yeah. So,
David, you were saying something.
no, just say, so how do you feel now, though? Do you feel real like you were normally before?
Andrew,
No, go back to work. Yeah, Andrew, when you go back to work, do you feel?
No. In the afternoon, I was shattered. I was absolutely exhausted.
Yeah.
And that went on for weeks and weeks and weeks. Sometimes I get shattered now on an afternoon. But most days now, I'm okay. 2:30, I were beat.
Yeah.
I really were. But now, 3:30, I'm beat. But yeah, it was very, very, very long struggle, to be fair, to get me back to normal.
Yeah.
Yeah, it was hard. I mean, we've got a really exhausting job, haven't we?
Yeah, that's it. Yeah, so
it's really hard, and to try and get back into full swing after having a stroke, I don't think you can comprehend how hard it really is.
Yeah. So I know that's what you keep doing. Like say I do something, then like say you do odd little thing, and then all of a sudden me left. I've got it in my left side, and then all of a sudden my hands don't work when I go to pick something up. It don't work. You know what I mean? So I know. Yeah. You just think, oh.
Yeah.
But both of you would agree that working along with the stroke nurses.
Oh yeah, the stroke team. Yeah, they're real good. Yeah.
I think it's fruitful that at the end of the day you will reach a very high level back to where you were.
Yeah.
Hard along with them, isn't it?
So no, I really like when they come, like you say, and then they talk to you, feel better then, you know what I mean? Because sometimes you get a bit isolated, thinking, "Oh God, I'm never going to get back to work," and then they do something with me, then I can't do it that week, and then next week she comes and I can do it. You know what I mean? So I can so it makes me feel better that.
Absolutely. So you're seeing improvement in every week, and that
every
kind of
week, yeah. So I do like saying, so it's like you know. So sometimes you try and do it, and you get frustrated, and then when she'll come next time and say, "Oh no, look, you've done it," so it's a little win for you, then, you know what I mean? So that all helps. But no, I really do think when they come, you know, from yourself to rate to, you know, while I was well looked after in hospital, I liked that. And these coming here, it makes me feel better, you know what I mean? Keeps you going.
That's really good. I mean, I think it is right for us, Aubrey, to talk about resources in the NHS, especially in this kind of climate with the delivery of mechanical thrombectomy. If I can ask you to just sum it up in a few sentences as to where we are. I know across the country that, you know, we have various units providing it, extended days and 24/7. So your thoughts on that before we sum up?
Absolutely. I think in the last 5 years, stroke provision in this country has been coming along at a pace. We now have 24 comprehensive stroke centres in England providing mechanical thrombectomy. I think one of the things was the number of operators who could potentially provide this. And this has increased even from the time when I started as a consultant in 2019. And when I started, there was probably about 70 to 80 of us, whereas now there's 110 of us. There's another further 33 interventional neuroradiology registrars of fellows who are coming through, and 24 of them will complete their training within the next 18 months. So in terms of operator numbers nationally, we're going up. We also have nationally, we've got 6 interventional radiologists who are providing mechanical thrombectomy services at centres, including our own, and also 2 neurosurgeons. So mechanical thrombectomy credentialing is there as well to provide that service. But there has been a huge push from many organisations, obviously NHS England, the UK Neurointerventional Group, UKNG, the Thrombectomy Implementation Groups, Stroke Association and Stroke Networks to try and expand and improve access to care nationally. And there is obviously as well ongoing research, ongoing trials, the whole purpose of which is to try and optimise care in hospital.
So don't they do it in every hospital?
Not 24/7, unfortunately, David, and that's
so I'm lucky I had it when I lived in Hull, then, aren't I? They don't do it all, do they? No.
Yeah, so it will happen, and it is the goal of the NHS to provide it across the entire for every one of us, because as we can see on cameras how well you two are doing, it is definitely so I think it's coming. I am really grateful to both of you, David and Andrew, for giving up your time to be with us to explain. As I said, this is a patient focus panel, and the only way we would know how you're doing is to talk to you and get a feel for it. And so thank you very much, David.
I know, but I want to thank you for doing my operation and getting me where I am.
Thank you.
I know.
So
I'm just glad you was on call when I had it. So
thank you for it, David, again. And so I think Andrew, any final comment before we sign off?
No, I don't think so, Doctor. I'd just like to thank you once again. As I say, I don't remember much of what happened any of the procedures or anything, so I can't comment on them. So I do apologise for that. But once again, thank you.
It's normal. I think I would like to, at this point in time, thank the British Society of Interventional Radiology, which is making enormous strides in trying to work with the UK neuroradiology group in trying to get mechanical thrombectomy up and running across the country. And I'd also like to thank the comms committee of the BSIR for putting up this particular Facebook Live event. Finally, we wouldn't be able to do this if we didn't work as a fantastic thing. So thank you very much, Aubrey, for being with us and being part of it.
Thank you very much for the opportunity, Rajiv.
Thank you. Yeah. Thank you.